Good morning, everyone. It's Mary Ann from the New York City Organization of Public Service Retirees. So this week I got a few phone calls from a few members of DC 37 who had heard Henry Garrido speak about our healthcare debacle. And they wanted some clarification on some of the things that they had heard. So I said, all right, so what are they saying? And they said, well, they don't understand why you're complaining about Aetna, that Aetna has been a plan that Henry said that all the retirees choose. Wrong answer. So active workers have 11 choices of plans that they could choose from. Retirees have 14. Well, at least we had, until the Municipal Labor Committee, including Henry Garrido, decided that they wanted to try to negotiate them away, or actually they wanted to negotiate them away so that they could finance the Health Insurance Stabilization Fund, which pays an active workers premium. It also pays an under 65 retiree premium for your health care. And then what is that premium? The premium is the difference between the plan that most people choose, which is GHI Senior Care, or GHI if you're active or under 65, and the HIP HMO plan, which is the benchmark, which is what the city has to pay up to. So just a quick search of some numbers for the senior population. So Henry said that Aetna is a plan. It's been in the offered by the city for over 12 years, and it's a plan that the retirees choose all the time. That is wrong. So of the city's population, the city uses the numbers that there's 250,000 retirees. We know that number's a little bit high, but let's play with their numbers, since that's what they keep touting. So the HIP benchmark, that is what the HIP HMO plan is. That's your HMO plan that most people don't choose, but that is the benchmark plan offered by the city. Now, GHI, Senior Care, which is the supplement to our Medicare plan. Now, there's over 206,000 people in that plan. That plan pushes the number as at about 92%, okay? Which tells you that most people don't choose the HIP VIP plan, they choose the Senior Care plan. They want the freedom to go where they want. And why is that? Is because we've always had a choice of plan. The New York City Health Benefits Program was born in choice until the Municipal Labor Committee, led by Harry Nespoli, Henry Garrido, and Michael Mulgrew, decided to strip all those benefits away and not tell you about it and screw the retirees because we are no longer in the unions. Now, retirees cannot be in a union. You can pay a loyalty dues or a co-payment or whatever, but under the law, unions cannot represent a retiree. Why? Because under the New York City collective bargaining law and New York State Taylor law, a union can only bargain for those in their unit for wages, hours, and work conditions. Since a retiree doesn't have wages, hours, and work conditions, there is no union in the state of New York that can represent a retiree. This is why union leaders were always told when the torch was passed down to the next executive director or union president, never touch a retiree benefit, until these three numbskulls came around. So you understand, this is not the way that this should have been. Most retirees do not choose Aetna. In the Aetna plan, there were only 7,200 people in this plan, the Aetna Medicare Advantage plan, that had been previously offered by the city of New York. Today, there's about 9,000, and that's because you freaked the hell out of everybody that they jumped ship thinking they were going to lose their health insurance. In the days when this was 7,200 people, that was only 2.88% of the retiree population. At the 9,000 number, it's still 3.6%. And that should tell you most people don't choose it. Your numbers are similar for active workers under 65. You do not choose managed health care. You choose GHI PPO, Comprehensive Benefit Plan. And for all the times that we hear you guys complain about a network or a prior authorization or a copay, guess who's negotiating that? Your union in the MLC. And it's not the healthcare plan that's doing it. It's the city and the MLC, led by Michael, Henry, and Harry, that allows them to do that to you and diminish your benefits and water them down. You shouldn't be bitching about Emblem. You should be bitching about the MLC and your union leaderships not taking a stronger position in not negotiating away your health benefits. Cold hard facts, dude. I hate to really tell you, Harry, Michael, you're not telling people the truth. Aetna has been offered by the city of New York for years. Yes, it is not a plan that most of us choose, just like most of you do not choose to be in HIP HMO. You choose it when you need to, or when you're forced into it, or if you're loyal to it. The rest of the people, the majority of the people, do choose GHI-CBP, including the seniors. Cold hard facts. Sorry, Harry. Sorry, Henry. Sorry, Michael. And Henry, stop lying to your membership and accusing me of interfering with union business. If you told your members the truth, retirees wouldn't have to come out of retirement and tell them. In solidarity, brother.